Good afternoon, everybody. We're on to the second episode of BW People HR Voices Season 2. Today, we have with us Mr. Yuvaraj Srivastava, who is the Group CHRO of MakeMyTrip. He's also the President of National HRD Network of Delhi NCR Chapter and a member of the advisory panel of Central Boards of Film Certification. He's been conferred with the LinkedIn Power Profile India 2016, Mark Darkshak Award 2022, and has been featured in 100 Most Talented Global HR Leaders and 50 Influential and Dynamic HR Leaders. He has also previously held various HR leadership roles in Asian Paints, the Oberoi Group of Hotels, and PepsiCo India. Firstly, welcome, Mr. Yuvraj. Thank you for being here with us today and giving us your time.
Yeah, Kavi, great to be here and thanks for inviting me. Looking forward for the conversation. Thanks a lot. Thank you so much to you and your team and Business World. Thanks.
So for the viewers, just an overview of what the topic for today is going to be about. So today we're going to discuss upon rethinking safety and health policies of employees at workplace. So let's start with understanding a little bit about your organization, Yuvraj. My first question is in two parts. So we all know that MMT offers a hybrid workplace. So with remote working on the rise, how do you think HR professionals can design health policies which address the emerging health issues like sedentary life choices or chronic diseases and mental health issues? And my second part of the question is, how does MMT ensure that employees working from home remotely, how are the guidelines in place so that there is safety maintained even at home?
Okay, so I think it's a great question. And at the outset, let me stick my neck out and say, Savi, that, while organizations may be working on a hybrid format or a remote working format, I think it's not something which is very, very sustainable in the long term, right? It's very industry specific, wherein you can really have remote working or the hybrid working places, or maybe also to do a lot to do with the type of role a person is doing, right? In MakeMyTrip, we have full working, but I know that because of the needs or also because of certain roles, we would have a certain number of people who would really operate from home on a given day. So it's basically clearly 80-20 sort of a ratio on any given day, for that matter, people working from home and people working from office. But yes, we encourage people to come to work from office unless they have a big constraint there. So that's something which is important to present. And I think we have reached to a stage wherein we pre-COVID, the way we used to work, and it was more or less in the similar format of some people working from home, some people were operating from office. So we are back to that. Coming to your question, I think wellness had always been an important element of every organization's overall holistic well-being policy and the framework. COVID has only accentuated it, and it has made far more important, visible, noticeable, and also, recognizable in the organizations, that how organizations are working through this. Clearly, as organizations, I think while people are working at home, one big important area is, and I feel is that while you're working from home, I think that your need for socialization, your need for networking, your need for also moving around, your need for also connecting with people at work in a social setup is important for your well-being. While being at home, one can really be productive, but at the same time, for mental well-being, it's important for you to continue to connect with your network, whether it is in office or outside. So how do you really encourage these things at the workplace or at home? Most of the organizations still encourage people to come to their remote or a hub working place once in a week or twice in a week, so that at least that social networking issues are taken care of, right?
Right.
Besides this, I think organizations are also focusing on providing space for people to really be comfortable while working at home, right? Offices are predominantly designed ergonomically offices are predominantly designed in terms of facilities, which can really be better for the working in tech and product world. I think that whether it's a screen or infrastructure or your laptops, everything is basically configured. Your workstations are configured. Your accessibility to the areas are configured to keep in mind safety. At home, it may really lack, wherein people can sit and work on bed, people can sit and work in a different area. So from that point of view, I think that making people aware of importance of getting into the working mode is important. So we continue to talk to people that when it's an office time, normally you need to get into that sort of a situation, get that sort of a mental and a physical frame to start operating. It increases the productivity. So I think organizations are doing it, and that's very important element of ensuring that people don't live sedentary life. People don't really get used to laptops in a manner that they start having effect on their vision or their health or a back issues, all that stuff. So a lot of sensitization around this is important. Also, I think of late, not only in MakeMyTrip, but in other organizations also, there are diverse sort of tools which are being provided to the employees to use so that they can be far more comfortable. They can use it for their well-being. I think I'm not talking about apps which are available for mental health issues and people can really consult. People are also being, talked about your support system, your mentoring, your buddy system within the organization. Who are the people whom you can really connect with? Organizations are also creating mental health first aiders in the organizations who can really be the first point of contact. Not that necessarily every time you need to go to a counselor to figure out what the issue is. Within the organization, people or managers are being trained to recognize early symptoms of a stress or a mental health issue, so that rather than really ignoring it, people can really start working well on it. I think I have also observed, and we also do it, is that there's a need to do a lot of gamification around well-being initiatives, right? I think that sometime back we ran a internal campaign wherein whole organization was divided into 15 teams. Every team was created based on people's friend circle and also teams. And then it was basically a stepathon sort of a thing. So over a period of 1 month, how many steps a team has taken. And I was surprised to see that even at the leadership team level, people had started looking at those numbers and started competing, and finally people got certificates. So I think that how do you gamify these initiatives at the workplace would really help people be far more conscious about the health. And I think that's what we have been doing, Savi.
So one very interesting thing that you mentioned, buddy mentoring. I think it's very important, especially in large organizations with large number of employees, where a manager cannot specifically give time to each and every employee.
Yeah.
So some great insights. Now, I came across that NNT offers medical insurance to spouse as well as parent-in-laws. So I found it really interesting. As the CHRO, how are you partnering with external stakeholders, let's say healthcare providers or insurers or even wellness organizations to ensure the well-being of your employees?
Fair enough. I think that, I think providing mediclaim policy to the employees, parents, and the spouses is not end of the initiative, Savi. It's very important to really use the data based on that how people are treating this benefit. Are people repeatedly using it? And who are the people who are using it? Which segment of employees are using it? Which segment of beneficiaries are using it more? And our record says, and most of the organizations will talk to the benefit providers, they would say that 50 to 60% of the claims are of the parents, and parents are the ones who are the biggest beneficiaries of these initiatives. Second number may be women in the younger organizations who are going for the maternity benefit. So these are the couple of categories which are mainly affected, and they're the ones who are the biggest beneficiaries of it. It's very important. First thing is that when you work with a service provider, look at the data, what they have. It's not end of the year you come back and say that, hey, what is the claim ratio? We had paid so much of a premium. Has it really resulted into a lesser claim or a higher claim? That's something which is important but not so important. Important is that look at this data to ensure that you keep improving your initiatives over a period of time, and also start identifying sections of people in the beneficiaries who need to be given a very different treatment. If that be so, I think it will be one of the biggest areas to impact. Like in our case, when I say that we have had people, parents are the biggest beneficiaries of this, right? And if parents are the biggest beneficiaries of this, you need to do certain things so that parents are also benefited, and at the same time employees are also equally responsible and take ownership of their parents' happiness, health, well-being, and all that stuff. So based on that, I think that with the help of service providers, uh, benefits of OPDs, benefits of discounted rate, diagnostics, these are the things which can really be done with a little amount of effort. And this what results in is less amount of illness, less amount of hospitalization, resulting into less amount of claims, which are finally also a resource of the financials of the organization. So I think leveraging data, what they have about employees, is important. Second is leveraging them for different sort of sessions within the organization is important. Like I was surprised last year we had one session from a neurophysician on headaches, and I think that we had a large number of crowd attending that session, and people were curious. And he talked about what type of headaches can be there. How does it really matter to really ignore, uh, take care of headache? So whether it's a migraine or it is something to do with else, or it is stress induced, what are the medication should be taken? People normally take Disprin. Is this the right thing to do or not? So it was an eye-opening session for everyone. So I think, and it happened only because you had focus on your service provider, and you looked at health as a comprehensive area to cover. And while you provide services, it's also important to keep creating awareness about illness, so that at the end of it, people get benefited and the beneficiaries get benefited. And finally, preventive care is solves issues which can really become complicated at later point of time.
So, well, you've answered my next question, which was about metrics and indicators that allow you to measure the or track the progress of your initiatives. Safety is not only limited to physical or mental safety. Cyber safety in today's date with rapid transformation in technologies is also one big issue. So, how, as an HR, do you integrate cybersecurity considerations to prevent, potential threats to data or even privacy threats of the employees?
It's a good question. And I think if you have a strong IT cyber security system, I think it gets taken care of. Like in our case, we are an e-com company. We have millions and millions of customers who are transacting on our platform. So as an organization itself, we are very strong in terms of our cyber security processes, right? And then what happens is that it finally starts cascading into the mindset of employees also who join. First clear initiative is when people join, there is a huge amount of induction based information given to people, that what is to be done, what cannot really be done, how people should really use the system, and all that. So completely, agreement or a code of conduct is signed with the employees. IT policy is there, which people go through it. What all they can use your official platform for is important. I think IT team and HR team also keep telling people that what sort of spams are happening in the world, in the cyber world, what sort of messages people should really be careful of, what sort of mails can really look very, very genuine, but how they can really be harmful for people in terms of the spams or the bugs. So regular sessions around this is through the IT team and also people who are cyber security expert. How the IT infra is being used, also I think that we keep a close eye on it. While you have different tools which are available to track happenings, we believe in prevention, and we don't believe in really holding people responsible and allowing people to commit errors which can really land them into a trouble. So proactive information around it, deeper information awareness about it, and also using a lot of case studies within the organization. We do a lot of case studies based awareness sessions. We say storyboard. So in case there are any issues, as a storyboard, it goes to everyone, and people read the incident, may not have the mention of an employee or a person, but finally it talks about certain things which might have been an issue of a code of conduct or a security issue on cyber security. It goes to people, and perhaps people understand the gravity of those situations. Having said that, I think that in our case, uh, our population is such wherein people are quite aware of what all threats can really happen. So the incidents will be minimal for that matter.
Right. So workplace safety incidents, they can have a very long-lasting impact on professionals. So how do you think the HR leaders can draft the health policies and foster a culture of proactive risk management and continuous improvement?
So I think HR leaders have a huge role. Way back, and I think currently also many organizations take people through medical tests, right? When they join the organization. Over a period of time, I think there is also a thought that I think it's a discriminatory. Medical tests should not really be done, because if people are fit, even if they are not fit, one can't really distinguish. I think, uh, I believe we don't do any medical tests when people join, but I think it's a good practice to really at least have a medical information declaration from people in the system, so that you have your systems geared up in case of emergency with any individual employee, right? Uh, as an organization, we also have internally a medical clinic which is manned by a doctor and a nurse on a round the clock basis. At least a nursing assistant is there during the day, not the round the clock. And then doctors on a different day, different specialty doctors also come into the system. They have their own database. We don't ask people to really tell it to HR that what disease they have, but I think their history keeps getting recorded with the doctor. Doctors take care of their issues, which are very, very first aid basis. Creating awareness about this and creating comfort around this again is something which HR does it as a policy. HR as a policy also needs to be sure that if they have a welfare fund, which is a medical or the emergency fund, where is it really being spent? It's not important in today's world to really provide benefit in a very democratic way to everyone, even if people are not using it, right? So, for an example, a few days back, we tried to figure out that how many employees are interested in parents coverage. And till last year, we used to give carte blanche everybody parents coverage. We used to only take the details of the parents and enroll them for the program. We realized that at least there was sufficient number of employees who said that we don't need coverage for the parents because parents are already covered. Gone are the days, like in our generation, parents were not aware of the Mediclaim policies. Now most of the parents are pretty young. They are between 50 to 60 to 60 to 65. They have their own policies. So I think a lot of people also said that no, we don't need coverage. So what happens is that money which used to go unnecessarily for the coverage, which was not availed, can really be deployed somewhere else, which is far more effective. Can it really be used for OPDs of the employees? Can it be used for the benefit of maybe children? Can it be really used for the inoculation? Can it be really used for the vaccination within the organization? Can it be really used for the yoga classes or something else which is far more effective? So as HR professionals, it's important to see what the need is.
Right.
HR as a HR professional, it's important to figure out who are the beneficiaries, right beneficiaries whom the benefit should be provided. We have an annual medical test for employees who are above 35 years of age. Earlier, we used to have it level wise, that people above this level will have an annual medical test as a part of the benefit. Later on, we removed the level. We said it's more to do with an age rather than a level of an individual. So I think that we went to that level wherein we do that. Our vaccination programs within the organization are very effective. Our internal medical facility managed by a external health provider is very effective. Our internal apps which are available for people to do the consulting online with the counselors is very, very effective. Our internal trained resources within HR and elsewhere on mental health issues are very effective. So I think that important is for HR to really look at the policies very comprehensively and not be always socialist and democratic in the approach, rather than really try to address the exact population which is needed, which needs to be benefited. Like our policy has traveling toddlers policy. So any women who has a child below 5 years of age can travel with the mother even for the official trips and can really stay with her and along with a nanny, and so stay and the travel, everything is taken care of. So I think it's important to really look at policies like that. Our policies of an open leave, we don't really track leave and say the leave is only for 10 days for the medical. Leave is open leave. Whenever you need leave, you take it after talking to your manager. So it can be 25 days, it can be 30 days. It doesn't make much of a difference because leave is something which people would take when they need it, sort of a thing. So I think that HR needs to be aware of the needs of people and create policies around health benefits, which are addressing the right constituency.
I think a lot of HR professionals and employers watching this video, they'll get a lot of inspiration from what MMT is doing in terms of health policies.
Thank you.
Any last piece of advice, Yuvraj, for the employers or the employees towards, working towards safety and health policies?
I think I would be honest in saying that organization is responsible to ensure that you get right sort of an awareness. Organization can be enabler. Organization can really facilitate. But finally, every individual is responsible for their own well-being, right? Till the time people are not employed, they do take care of their health, right? When people retire, then also they take care of health. And prevention is better than cure. So it's important that employee themselves or individual themselves should really be very, very cognizant and conscious of their health. Depending on the organization, for things which are, last minute, may be fair, but also undue expectation. So it's important for people to take care of their health. Reach out in case they need any sort of a support from the organization. Organizations can support. Organizations can't own up the responsibility of the health of individuals, right? And that should be the thought in the minds of employees. And for the HR professionals, I think it's important for you to look at your policies, not how many policies have you made. It should be more seen in terms of how many policies have been availed and to what extent it has been adopted and taken benefit of. Policies made just for a purpose of a campaign or a practice or for demonstration of intent is not enough. It's important that every now and then you also go and evaluate how effective your policies are and are they helping people or not. If they're not helping, either you need to change or you need to completely modify them so that it becomes far more focused on providing benefits.
Absolutely, I agree with you. Thank you so much, Yuvraj. I think the viewers have gotten great insights, valuable insights from this session today. Thank you so much for giving us your time today and being here with us.
Thank you. Thanks a lot, Savi. Great talking to you and all the best. Thank you.